guys, this is Tasha McNerney and I want to do a quick Whiteboard Wednesday session, and today our topic is going to be blood pressure. A lot of people have talked about blood pressure, what we should do when our patients become hypotensive under anesthesia. So for all you new baby technicians out there who might just be getting started in anesthesia, this is going to be something you're dealing with a lot. So I just wanted to go over this really quickly. I know this looks really intimidating, but it's not. You'll get there. This is probably the most important equation you can keep in the back of your head when you're monitoring a patient under anesthesia. And this means that your mean arterial pressure is equal to your cardiac output times your systemic vascular resistance. So your resistance is kind of think about, this is when we talk about the garden hose, right? Either the garden hose being very small and there's more resistance, or being very large and there's less resistance, right? So more resistance, less resistance. Our cardiac output now is made up of our heart rate and our stroke volume. So this is something important to keep in mind, as well as this. When we break down our stroke volume even further, we see that that's made up of preload, afterload, and contractility. So these are all things that we need to keep in the back of our head when we're trying to determine how are we going to treat our patient's hypotension under anesthesia. Now, most of the time when you have a patient under anesthesia, they're often young, healthy patients, and they're just experiencing a little bit of hypotension under anesthesia. And this is most often related to the drugs that we're using, right? So if you think about the drugs that you're using commonly in anesthesia, these are things like inhalant anesthetics. These, are things like acepromazine or propofol. All of those drugs that I just named, inhalant anesthetics, propofol, acepromazine, are going to decrease our systemic vascular resistance because they cause vasodilation. Also, these drugs are going to affect our contractility and sometimes decrease our contractility, so that's important to keep in mind as well. So if you have a young, healthy patient that is under anesthesia and they become a bit hypotensive, that's why we say one of the first things that we want to do is lighten up on our inhalant, right? We dial back our inhalant a little bit, take away some of that vasodilation, and that's going to help our patient. Again, this is why we want to keep this equation in the back of your head, because it's not always vasoconstriction or vasodilation that may be contributing to the problem. Oftentimes we have patients under the influence of anesthetic drugs. One thing that comes to mind is like cats under anesthesia for a little bit, especially cats under anesthesia for dentistry, and their heart rate starts to drop. And then we might notice that they're hypotensive, right? So if we had a cat under anesthesia, their heart rate is now 80. If they're well hydrated, I don't assume that their problem is really volume. Their problem is because their heart rate is too low, right? We're not going to get what we want cardiac output-wise because our heart rate is low. So what we want to do is change that heart rate. We could give them bolus after bolus after bolus, but if the cat's heart rate is 60, 70, and it's just not where it needs to be, we're not going to change our map very much. So these are some things to keep in mind. Do I think my patient's heart rate is low and I need to fix that problem? Is this a volume problem? Is my patient hemorrhaging? Are they here because of trauma? Are they here because they have a hemoabdomen, so all their volume is in their belly? If so, if volume is your problem, then we need to add more volume. We need to make sure that we are doing things to get volume in them, either be crystalloids, you could talk to your doctor about doing blood transfusions, plasma, etc. If we think our problem is systemic vascular resistance, if we vasodilated them too much, then we need to lighten up on those drugs or take away those drugs and potentially even treat them with things like vasopressors that would put a little squeeze on those vessels. So keep this in the back of your mind all the time. I know this is a lot of information to take in, but if you guys can just remember that your blood pressure, right, our mean arterial blood pressure is equal to our cardiac output times systemic vascular resistance, and think when your patient is under anesthesia, which one of those things is the most likely to be contributing to that hypotension. And that will give you a good guide as to where you want to go to fix the problem.